Funding for this program was provided by the Annenberg CPB Project.
Sometimes, as we go through life, we master our experiences. Sometimes we don't.
Nick Crane is not a typical teenager.
Going to the left, pull to the right.
He has problems. He has trouble walking, he can't speak clearly, and he has trouble remembering things.
As much as you can.
One thing he can't remember is exactly what happened to him that caused many of his problems. But what happened to Nick is something his mother will never forget.
It was a very hot summer day. It was about 4 o'clock in the afternoon. His grandmother was visiting from Canada. His other grandparents had come over. We were just all sitting on the patio to relax and have an afternoon cocktail before we had a cookout. And my elder son had put up this 30-foot swing that everyone had been enjoying for a couple of months. And I kept saying, that swing is going to do some harm to somebody, but, you know, oh, Mom, you're always ruining.
And Dad always said, I don't remember you saying, but I remember that someone's going to get hurt on that swing.
Well, I remember saying that, too. But anyway, it was everybody using the swing, and all of a sudden Nicholas went to swing, and he swung out, and there was like a dead silence and a thud.
Nick landed on the left side of his head with enough force to cause his brain to careen violently around the inside of his skull, leaving him severely brain damaged. He spent a month in the hospital and then 2 years in physical rehabilitation. But the injury to his brain created psychological wounds that took far longer to heal. Larry Gurrell's brain has also been damaged, not from an accident, but from a disease that has left him severely impaired. Wyatt Ingram has no short-term memory, the result of many years of alcohol abuse. The problems these people have are known as organic mental disorders. Generally speaking, organic mental disorders fall into one of 3 categories. Physical trauma, injuries from falls, accidents, or blows to the head. Medical problems, such as Alzheimer's disease, Parkinson's syndrome, AIDS, and stroke. And toxic substances, environmental pollutants, as well as drugs and alcohol. In this program, we will look at just a few of the many types of organic mental disorders.
Literally, organic mental disorders.
Robert Carson is professor of psychology at Duke University in Durham, North Carolina.
The term organic mental disorder refers to instances of mental aberration, mental or behavioral aberration, in which there is accompanying evidence of structural or functional physical impairment of the brain's hardware, if you will, and where this physical impairment is assumed to be causal of the behavioral output.
Now touch your nose.
To better understand how certain types of injuries, disease, and powerful chemicals can affect a person's behavior, it is first necessary to understand how the human brain works. The brain is the most important organ in the body. It controls all of our functions, how we think, feel, and move, our ability to communicate, to remember, and to understand ourselves and the world around us. The outer layer of the brain is called the cortex. It is here that all of the bits of information that come into the brain are integrated, processed, stored, and retrieved. Beneath the cortex is the limbic system. This part of the brain is where our emotions, sex drive, defense mechanisms, and memory are managed. When any part of the brain is damaged, one or more of the functions will be altered, weakened, or destroyed. For example, an injury to the frontal lobe can create problem-solving difficulties. Damage to the left temporal lobe can impair speech. If the occipital or visual lobe is affected, a person might not be able to recognize familiar faces and objects. The brain itself is made up of billions of cells called neurons. As this highly schematic artist's rendering indicates, these neurons form networks or pathways throughout the brain. The neurons transmit information by means of electrical impulses to and from the brain's different areas. The individual neurons communicate with each other across minute gaps called synapses. Chemical substances called neurotransmitters flow from one neuron to another. These neurotransmitters lock onto receptor sites on the neighboring neuron, continuing the flow of information. This infrastructure is complex, and it is fragile. Damage from injury or illness can upset the balance that exists within the brain, impairing normal functions. This, in turn, can lead to numerous intellectual and emotional problems. Over 2 million people in the United States suffer a head injury each year. Some 500,000 are severe enough to require hospitalization.
The other three things all have...
The psychological effects of head trauma occur along a continuum. Some are minor and transitory. Others are devastating and permanent.
Okay, let's take the blue cone.
One can have one's brain injured in a variety of ways, quite obviously. There are famous cases on record, the famous crowbar case in which Phineas P. Gage was blown away by a crowbar that literally transversed his head from here throughout the top. And Phineas lived, remarkably enough, but was changed very substantially in consequence of that experience. He now was sort of out of control. He swore a lot, in contrast to his prior very proper behavior. Could not be relied upon, again in contrast to his prior behavior, and in general exhibited an inability to keep things regulated, particularly in relation to emotionality and impulsivity.
There was not much that could be done for Phineas Gage after his physical wounds healed. But head injury rehabilitation has advanced greatly since his time. Today, science and medicine enable us to look inside the brain, to assess the physical damage. Psychological damage cannot be seen with technology. That is evident only in the behavior of the injured person. This is the New Medico High Watch Head Injury Rehabilitation Center in New Hampshire. Stephen Baker is a permanent resident here.
Stephen.
In some ways, Stephen Baker's story is similar to that of Phineas Gage. While his injury was not as dramatic, the psychological effects were far greater.
All right.
An automobile accident destroyed many parts of Stephen's brain. The widespread damage left him with severe problems. He cannot speak. He has limited intellectual ability. He has little memory, and he has no control over his emotions. In fact, his deficits are so severe that he cannot live in mainstream society. Nick Crane's injury was similar to Stephen's, but not nearly as damaging. He did return home, but then he began to experience a number of emotional problems.
I think that's when the decline started in, and a lot of stress started to build up. I think he was having more difficulty peer-wise as well. I think he was a typical teenager and starting to experiment with alcohol once in a while, an occasional joint. And there were several family problems at the same time going on. And so our family life was really very dysfunctional at that point. And very shortly after that, my husband left the household. And it was shortly after then that really I could see almost a psychotic type of behavior and depression.
I would just sit in that house, and every time I came home from school, and just sit there, and I went a little stir crazy after a while, and took the car out.
He didn't have a driver's license at that point, and we had discussed the car. We were going out actually to clean the car, and he just took off with it. And when he came home that night, it was just visible that I had to take him to the emergency room, that I couldn't control the situation anymore.
When I was admitted after taking the car out, that I was really sick then. I admit that I was. Like, I was lying in my bed, and I would hear people crying, laughing at me, just lying in my bed, and hear this outside, and I knew I needed some help, desperately.
Nick's injury left him with several problems. He had difficulty speaking, lost his coordination, and he could not solve even simple problems. Nick also developed severe emotional problems. He became socially withdrawn, had trouble remembering things. He often felt anxious, impulsive, and frequently very depressed. These types of problems are typical for people who have injured the frontal lobe of the brain. Such people have problems initiating activities, planning things, exercising judgment, understanding social situations, and regulating their behavior. These psychological problems are a direct result of the injury. But some problems, such as depression, can also come about indirectly, when people realize they will never quite be the same again. Dennis Russo, Director of Behavioral Programming for New Mexico, explains.
Depression can be caused by many things. It can be caused by many things in a non-head injured individual, such that you have endogenous or internal depression and an external or reactive depression. Both seem to be caused by different things, may be responsive to different therapies. Similarly, in brain injury, we find that depression can be a secondary outcome of the brain injury itself. That is, if a certain part of the brain is injured, it leads to depression. On the other hand, it may be a reactive depression, particularly as clients emerge, as they learn, as they become more oriented. Many become depressed because they realize that they're never going to be the same as they were. Learning to cope with that, helping the client to cope with that psychologically, is a wholly different issue treatment-wise.
I had a birthday party.
Problems resulting from head injury often impact on the person's family life as well. Nick's parents separated after his injury. As part of his rehabilitation, Nick is learning ways to help himself deal with some of the emotional problems surrounding that event.
But I called my dad one day to, ask him to come on over, and he didn't know. See, he was talking originally to my sister, and then my sister gave me the phone, and he was still talking, and he said, I'm not gonna come out to the house just for a birthday party, and that he didn't know I was on. He thought my sister was on, and that made me feel sort of down and depressed.
This sounds real similar to some of the early...
David Lennox has been working with Nick for more than a year.
We instituted a problem-solving strategy early on that Nick has since implemented independently. It's fairly simple, but we made it quite a salient, rigorous procedure where through paper and pencil he would write down a problem, define it fairly objectively, come up with several solutions, advantages and disadvantages of those solutions, and then pick the best solution. Those are strategies that you and I use every day that he needed assistance through every step on. And he now does that fairly effectively, independently.
As a result of the behavioral and cognitive skill training he has received, Nick has been able to recover some of his losses to the point where he is ready to leave the controlled environment he has been living in. How he fares in the real world remains to be seen.
It's the client's worst behavior, not his best behavior, that will determine his future. By identifying for each head injured individual those receptive channels which are least damaged, by focusing our therapeutic and teaching approaches in that way. And then by gradually changing those approaches to take and deal with more and more complicated problems, what we find is that individuals are able to learn to function in ways they could never function before.
I think Nick and others like him will be able to function fairly independently, go about daily living just as you and I do, acquire jobs, albeit they may be slightly less sophisticated jobs, but in some cases, but given cognitive impairments and memory impairments which still may exist. But there are a great many compensatory strategies that help overcome those to let Nick and others lead pretty successful lives.
I've seen like the ideal person I wish to be, and I just do everything like that person. Like, I don't know, I walk like him, and I talk like him, and I work hard trying to fix my deficits. And that has made me, that person has been a driving force within me to accomplish my goals.
For many people with head trauma, the stage of recovery that Nick has reached is often the first step in a more difficult process, returning to the same world they knew before they were injured, but with less ability than they once had.
Even small things add up very quickly with a head injury. It's so hard to handle so many little problems that you handled spontaneously before. Now you have to...
Dr. Yehuda Ben-Ishai is director of the Head Trauma Program at the Rusk Institute in New York City.
We told you in various
the patient himself is rarely aware of the crucial consequences of the head injury in terms of what it did to the cognitive abilities and what implications these deficits have down the road in life. Then you have another major problem on top of these, and that is the problem of the person's sense of self. The injury has affected the central mechanism that guides what we call the thinking, planning aspect of the individual, as well as the self, the sense of self. And if this is disturbed, it is not surprising that the individual's sense of self-esteem, confidence, is very seriously shaken up.
Dr. Ben-Ishai's program is based on a 6-stage model. Each stage is viewed as a landmark in the patient's total rehabilitation.
I'll try it without the counting out loud now.
However,
the first part is to engage the individual appropriately in the process of learning. Rehabilitation is learning. Engagement has two components. One component is to optimize the person's attention and concentration. Without attention concentration, you cannot have a pupil. So that's the first part. The other end of the engagement is psychologically giving the individual who has been scared out of his wits, is disorganized, confused, giving him or her a sense that this is my life and I'm going to take charge. So engagement means literally optimizing attention and getting the individual to become an active partner, a motivated active partner in rehabilitation. That's the first stage. Once you have accomplished a reasonable degree of engagement, you have to make the patient aware of the problems that the injury has caused without breaking the patient's spirit.
Can you tell Sam and Daniel and us, to what extent do you feel that some of the boo-boos, some of the problems that you have mentioned initially, can interfere and foul up the situation and thinking?
I'm not as motivated as I was before. I'm tired. I get tired more quickly. So that takes away from my ability to reason or to remember things. I'm so tired that I can't work on reasoning with people or remembering what I have to think about.
Making them aware requires very careful and delicate work to bring to their attention some of the terrible deficits show the connections between these deficits and failure in life, and yet at the same time not to stifle their desire to keep on fighting.
The third phase in the program, compensation, evaluates the person's potential to learn new skills.
So, for example, this is red. You would start by counting out the number of reds, put them in this tray, okay?
In the phase of compensation, you really have to answer three basic questions. Can this individual learn? And if so, at what level of sophistication can the individual learn? If he learns some routines, can you teach this person work routines, thinking routines, all kinds of routines of solving problems? If so, what will it take to make this stick? Because brain injury results in serious memory problems often. So can he learn? Can he retain it? Can he apply it appropriately? And the third question is, can the person improvise and problem solve in unexpected situation? And our job under compensation is to get these three things.
As you know,
While the person is learning to become aware, to become engaged, and to compensate for the deficits, the individual must also learn to accept that brain injury cannot be completely reversed, and that many of the deficits are permanent.
I know that I'm not going to be the way I was. That's forgotten. I don't want to be that same person. However, I would like to have the same capabilities.
We use a very strong metaphor to our trainees. We tell them no one has learned to rewire the brain. So what is rehabilitation? Rehabilitation is learning ways to troubleshoot around the problems without changing the spare parts. What it means on a practical level, that the individual in the end must learn to accept everything that could be done was done. This is what I can do, and yet accept this with a certain grace and dignity and say this is a worthwhile accomplishment. The next phase is, now that all was said and all that could be done was done, what kind of work situations could you fit in order to train you gradually to become a productive worker again? That's when we take our trainees and we send them to the occupational trials phase, which is the practical training before the step which is graduating and sending them out to actual work. This is the time when we determine what kind of a worker he will be. Can he become a worker, full-time, part-time, and does this person have the capacity, when away from this training cocoon, if you wish, can the person apply independently all the tricks of compensation that he or she has learned during this phase?
The final stage of the resocialization process is the placement of the program trainees in real-world situations. These three people are graduates of Dr. Benny Shea's program. Terry was injured in an automobile accident 1.5 years ago. He used to run a publishing company. The pressures of that job are too much for him to handle now, and so he has turned his attention to writing. Nonetheless, he is satisfied with the outcome of his rehabilitation.
Well, I sort of reflect philosophically, if you will, that I think that all of us in life are given a deck of cards. With the head injury, that deck has been reshuffled, and you have to play your new hand, so to speak. So there are aspects of that new hand I rather like, that I'm not as bitchy now, I'm not as compulsive now, I'm not as much of an overachiever now, that sort of thing. There are pieces that I miss. As I sometimes say, my compulsive knowledge of the irrelevant is not what it used to be, but perhaps that just gives my head more room for more important things to be there.
Celia was a bank executive before she was injured in a taxicab accident. She's working in a clerical job now, and only part-time. But she has come to terms with the limits her injury has placed on her life.
I've always gone, people go for 100%. My goal has always been 101%. And even though I can't do what I'd like to do, I realize, or whatever I end up doing, this is my 101%. So this is my best.
Mark was run over by a bus when he was only 13 years old. He has had 9 operations on his head since then. He has also suffered from alcohol and drug abuse. Today, Mark works full-time as a teacher's aide in a program for disabled children.
been a lot of just hard-nosed drive, and don't let the little things get you down or overcome you. Just keep plugging.
Yes.
Because the minute I know I quit, it's like saying, oh, the heck with the world, I'd rather curl up in a ball and die. Life is too precious to do that.
Long after the physical wounds have healed, there are many psychological problems people with head trauma must overcome. The Rusk Institute program addresses their cognitive, emotional, and personal deficits. Learning exercises enable people to become aware of the extent of the deficits. Skill exercises teach them how to compensate. And community activities help them understand and accept the permanent changes their injuries have caused.
The same capabilities.
Larry Gurel was once a high school guidance counselor, helping students make important decisions about their lives. Today, Larry Gurel has difficulty making any decisions at all about his own life. Once outgoing and opinionated, he is now withdrawn and depends completely on his wife, Willadine, who tries to help him find his way in a world he can hardly recognize.
Everything is difficult for him. Everything. Brushing his teeth. Where are my teeth? How do you hold a toothbrush? Everything is a decision.
Alzheimer's was once thought to be a rare disorder. However, some 4 million Americans have been diagnosed with the illness. Today, nearly 10% of people over 65 have the disease, and almost half of those who are over 85. And the number of cases is expected to increase. Like many Alzheimer's patients, Larry Gurel began to experience problems with his memory. He also began to behave differently.
He would misplace something like his keys. Now, the misplacing it wasn't a strange thing, but his reaction to misplacing it was strange, because there were just two of us in the house, and he'd say, well, somebody moved my keys, and I didn't do it, which was so unlike Larry. And I argued with him a while, and then I thought, well, this is the silliest argument I've ever had in my life. So let's forget that. That was the first symptom.
Can you make your hands look like that?
In the 4 years since, other problems have surfaced.
Yours look just like
Larry's
mine.
thinking has become confused. He forgets what things are and where he is.
What about now?
He sometimes doesn't recognize his wife.
Can you make yours
An
look just
educator
like mine?
before his illness, he now is losing his ability to form new thoughts
just like
and
mine.
communicate them.
For the most part, just recently, I have not read did a corn.
Driven a car.
Doing a corn.
You're not driven a car.
What happens in the brain of an Alzheimer's patient that causes such profound problems? In the early stages of the disease, the areas typically affected are the parietal lobe, producing language problems, and the temporal lobe, producing memory difficulties. As the frontal lobe becomes involved, severe behavioral changes may come about. Some people develop depression. Others become belligerent.
It happens that I had a grandmother myself who suffered from Alzheimer's disease, and she felt very strongly, I was a little boy, that my grandfather, who was in his 80s, was taking off to the local pub, an Irish pub that would not let women in. He was accused of meeting women in the pub, and that was why he was going there regularly. My grandmother took to following him there and raising quite embarrassing scenes, following him all the way home with various obscenities and so on, to get him out of the clutches of the women that she imagined were beating him in the pub. I have some appreciation of the embarrassment of this because I was a little boy, and in my imagination, the whole neighborhood sort of was participating and observed this scene. It was awfully embarrassing, and at that point, of course, I had no very good explanation about what was going on.
Alzheimer's disease may be caused by the development of protein fibers or plaques that attach to the ends of the neurons. It is thought that these plaques then destroy the cell. Along with the loss of cells is a reduction in certain neurotransmitters that aid in the communication of information throughout the brain.
He came for a second diagnostic opinion, as well as to potentially participate in treatment trials for progressive memory disorders.
The fact that this process happens in diffused areas in the brain helps to explain why the symptoms related to Alzheimer's disease can be so varied. Nancy Earle is a neurologist and clinical psychologist at the Duke University Alzheimer's Disease Research Center.
There are a variety of changes that can be seen. What I think is seen most frequently is a social withdrawal and isolation to some extent. Frequently early on you may see withdrawal from activities, sort of tending to stay home, not being as active in church or hobbies or different kinds of things, not wanting to speak out as frequently, and basically a social withdrawal. People become more dependent on their spouse or on their children, and people that may have been very independent will start to defer more to other people's judgment, allow other people to make the choices.
I was first attracted to Larry because of his intelligence and his sense of humor. Those were the two first things to go. Here was a man who was well informed about politics, current affairs. He can't read a newspaper. If he watches television, he does recognize a few conservatives that he doesn't agree with, but for the most part he doesn't recognize really what's on at all. He can't drive a car and hasn't driven 2 or 3 years. And he's quite willing to quit, which was a big advantage to me. He was always very careful about his dress. Now I pick his clothes, put them out in the morning. I sit beside him as he gets dressed, and he looks at his sock and he thinks, do I put the sock, you can see him, do I put the sock on my foot or do I put the sock in my shoe? Everything is difficult for him, everything.
Okay, Mr. Gorell, I'm going to go over some questions with you like we usually do when you come to see us. And what I'd like you to do is to just try and answer these as best you can for me, okay? If you miss it...
Not all Alzheimer's patients present in the same way as Larry Gorell. There are other diseases that can cause similar mental impairments, making Alzheimer's difficult to diagnose. Testing for Larry Gorell's specific deficits reveals the extent of his illness and provides an indication of the areas of the brain that are being affected.
Okay. And what season of the year is it?
It's in the 19 what? Or I mean,
what season is it?
Season. It's in 19th season.
We will do a mental status exam, and basically that's a systematic way to explore different areas of function in the brain. So you test memory involving the temporal lobes. You test language involving the left temporal lobe. You'll test ideomotor praxis, or using hands in tasks, writing and manipulating objects, basically thought to be parietal. So you'll explore a variety of cognitive questions in testing the mental status.
What I'd like you to do is to take a look at this drawing right here and try and draw it again for me right down there, okay? Take your time on that.
Those particular tests that he had are also specifically designed to tax areas or to test areas that we know are impaired in Alzheimer's disease. People can appear very unimpaired, and when you're put in a confrontational setting, it taxes you such that you don't perform as well.
That's pretty good.
It is often said that in Alzheimer's there is a second patient involved, the spouse or family member who is the day-to-day care provider. Lisa Guither is director of the Duke Family Support Program.
A person with Alzheimer's disease loses their memory, and so they can't learn new information or learn from experience or draw on their experience. The caregiver, on the other hand, has vivid memories of the person as they were, and as they were when they loved them or knew them, and can learn new information, can draw from experience, and can get better. They can be helped to understand why the patient behaves the way they do, and how to be a more effective caregiver while still reducing the negative consequences of providing that care on themselves.
What's that a picture of?
It may be 20 years between the onset of memory problems and the end stage of the disease when it is terminal. The time between diagnosis and death is marked by slow and continual intellectual, emotional, and physical decline, placing extraordinary stress on both the patient and the caregiver.
Sometimes he says to me, life isn't worth living this way. Sometimes he says to me, I'd like to die. And I can't seem to say to him, oh, no, Larry, you don't want to die. This is a great life you have. Sometimes, however, as we were driving over here this morning, he said, you know, I really think I'm a lot better. So he is not consistent about it, but he is unhappy. He is frustrated. He is fearful. But you think just a minute, how would you feel if when you get up in the morning, the room is strange, you don't recognize anything? If you look at the woman in bed next to you and you wonder who she is? If you go to the bathroom and you don't really know where the commode is, you don't really know where the toothbrush is, everything is strange. His reflections in the mirror. I have a sheet of tablecloth taped over our mirror in the bathroom now, because otherwise he thinks it's an enemy. He currently thinks his feet are children. And apparently they're not very loving children, because I can hear him go. They must be teenagers, I've decided. They're very aggravating to him.
I also try and get them to understand the role of fear. Patients are very frightened if they don't understand what's going on, and they're looking for reassurance, and they're looking to make sense of their environment. And so their gaps in memory, sometimes they fill in by making up stories, confabulating. If they can't find something that they've misplaced, then someone must have taken it. And it must have been whoever's in the house, their children, their spouse, whatever. If they're frightened of being left in a world that doesn't make sense, then they're more likely to accuse a spouse of infidelity or of leaving them. So that if people understand and reappraise the behavior and personality changes and say, if my wife did not have this illness, she would not have behaved in this way. And this is beyond her will or her control. And it is also beyond my control to change that.
It may be another 10 to 15 years before Larry Gorell reaches the terminal stages of Alzheimer's disease and dies. During that time, his intellectual, emotional, and physical losses will continue. Yet Mrs. Gorell, like many caregivers, is committed to providing the support Larry needs as long as she is able.
People do this because they believe that this is what a family should do for each other, or a spouse or a parent. Sometimes it comes because people say, she was a good mother, or she was a good wife and she would have done the same thing for me. But they don't. The one thing that happens in caregiving is that there's this total change in the normal give and take of relationships. In an acute illness, you know, if your husband is hospitalized for surgery, that you'll mobilize, you'll give it your all, and eventually he'll get well. And if that ever happened to you, he probably would do the same thing for you. In a progressive chronic illness, you're giving more and more, and that person is never going to have an opportunity to pay you back.
Well, I think that people might be interested in what are the emotions that the caregiver feels. First of all, you feel a great deal of grief. You see day after day after day a person die. His intelligence. Somebody just recently told me her mother had a sense of humor. You can't have a sense of humor if you don't see relationships. Funny paper's not funny unless you can understand what's back of it. His physical health has broken a great deal. He walks like a much older man. So it is grief. It reminded me a little as if a surgeon says, we're going to do major surgery, but I'll tell you what, we won't make a great big deep cut. We'll just cut a little bit each day. So don't really hurt much. If you won't need an anesthetic. So every day you cut a little bit more, a little bit more. That's grief that goes on and on.
One of the most enduring tales in English literature is Alice in Wonderland by Lewis Carroll. One of Carroll's most extraordinary characters was the volatile and quite irrational Mad Hatter. This character was actually based on a very real and well-known fact of 19th century life. that many long-term workers in the hat-making trade frequently exhibited erratic personality traits. These behavioral problems came about after years of exposure to toxic mercury used in the process of making felt. This behavior was so common that the expression, "to be mad as a hatter," earned a permanent place in the English language. Like the experience of the hat worker 100 years ago, exposure to toxic material remains an unfortunate consequence of contemporary life. There are numerous potent substances found not only in the workplace, but also in the environment, that can produce a range of physical and psychological effects. The substances that have an impact on the cells of the brain and a resulting psychological impairment are called neurotoxins. Like traumatic head injury and Alzheimer's disease, neurotoxic substances can affect several different areas of the brain, producing a spectrum of cognitive and behavioral disorders. One recent and dramatic example of the effects of neurotoxic exposure occurred in Michigan in 1973. Thousands of people were accidentally exposed to toxic polybrominated biphenyls, or PBBs.
In the summer of 1973, in the process of mixing animal feed in the state of Michigan, someone made a mistake. And as a result of this mix-up, in the places where they mix the cattle feed and also chicken feed, they mix a fire retardant, fire master, with the cattle feed. Now, nobody knew that, and many months after the fire retardant was left in the food chain, people will notice very interesting changes. You know, the cattle will experience a very severe weight loss. The animals will die for no apparent reason. And people will experience unusual illnesses. You know, those people farmers are very hard working. These people are getting up, 4 o'clock in the morning, and you will find stories of a very clever, very successful farmers that will not get up until 10 o'clock in the morning.
In addition to oversleeping, farmers reported depression, an inability to concentrate, and severe memory loss. In a few months, as the PBBs spread through the food chain, these same symptoms began to show up in the population at large.
Because of the concern that we actually did not know the extent of the contamination, 2 years later we studied a cross-sectional of the entire Michigan state for the prevalence, and we found that almost all of the Michigan residents have demonstrable levels of exposures in the blood and blood.
The psychological effects of toxic substances are frequently present even in the absence of physical symptoms. The implication is that a higher degree of awareness is required on the part of the public and the clinicians who might see these people.
The idea is that you have to be alert that there are certain elements, animal, plants, chemical compounds, that through the improper handle or the improper absorption or accidental absorption will cause a behavioral change which you might not be noticed with the clinical approach. That is the most tragic consequence, and where the psychologist could make the most important contribution. There is no gross effects that will kill you. I mean, lead, you have to really take extraordinary amounts to kill, but it will, by minute dose, it will produce subtle effects that you only notice when you challenge your brain to do certain tasks. This is the message that is clear.
Alcohol is also a neurotoxic substance. For some social drinkers, the deleterious effects of alcohol are minor and transient. For others, these effects can be deadly. Long-term alcohol abuse can also be the source of other problems, including permanent changes in personality and mental ability.
If someone is a chronic alcoholic and is drinking a pint or a quart of whiskey a day, and he does it over many years, he develops a loss of certain cognitive abilities. The most striking of these are conceptual abilities, problem-solving abilities, perceptual abilities. Memory remains relatively intact.
Nelson Butters is chief of the psychology service at the Veterans Administration Medical Center in San Diego.
The defects are tend to range from mild to moderate in severity and tend to be related to how long an individual's been drinking.
Wyatt Ingram is good with his hands. A former supervisor for an aircraft manufacturer, he keeps his skills sharp by working around the house he built 50 years ago. Mr. Ingram can easily recall the day he bought the land his house sits on. What he cannot remember is what day it is today. In fact, he doesn't remember anything that has happened to him for more than a few seconds. Wyatt Ingram literally lives from moment to moment.
It's difficult. He wears himself out because he has to continually do the same thing over again. A simple task like putting up the mini blinds in the kitchen that normally would have taken him a half hour, he worked on for 4 days because he had the mini blinds lying out here on the floor, and he would measure them, and then he'd go out in the kitchen, he'd forget what the measurements were and come back and remeasure. And he has to work so hard to get anything done.
Wyatt Ingram has Korsakoff syndrome, a rare neurological impairment caused by long-term alcohol abuse and a deficiency of the B-complex vitamin thiamine. This combination causes damage to one specific part of the brain.
Korsakoff syndrome has been associated more with the malnutrition that alcoholics invariably suffer, and more specifically with thiamine deficiency. So that if someone is thiamine deficient for a given period of time, this will lead to an acute episode of bleeding or hemorrhaging in a particular part of the brain, namely the thalamus of the brain, and he'll be left in a totally amnesic state. That is, he will be unable to learn new information, he'll be unable to recall the past, and this will be chronic. This, in most cases, will remain permanently for the rest of the patient's life.
The thalamus is sometimes described as the brain's central relay station. It is by way of the thalamus that new information is stored as memory in other parts of the brain.
Hello. Well, my head feels like an accordion. Other than that, well, I'm fine, Sherry. You want to speak to Harriet? Well, just a minute. It's Sherry, Harriet.
So while Mr. Ingram can recall events of more than 30 years ago with remarkable clarity, he often cannot remember what has happened more than 30 seconds ago.
Could you tell me who just called you on the phone, Wyatt?
Who called me on the phone? Someone that wanted Harriet.
Do you remember who it was?
That was her sister.
No, it was Sherry, honey.
Oh.
Our daughter-in-law.
Daughter-in-law. Well, I made a good guess anyway.
That's right.
Because of his profound learning disability, Wyatt Ingram was initially diagnosed as an Alzheimer's patient. But Dr. Butters determined that unlike the typical Alzheimer's patient, many of his other cognitive skills, such as his ability to express himself, to compute math problems, and perform complex motor skills, were intact.
Why don't you give me all the words you can think of to start the letter F?
Oh, fight, fry, fist, first, funnel.
I did assess aspects of his general intelligence, vocabulary, his language functions. I had him do some fluency tests. Those were all designed to get at his basic overall mental status or intelligence. And you'll remember that he did quite well on many of those tests. Where he failed is when I got into tests of memory. What I'd like to do again with you, Mr. Ingram, is again to see if you can remember the date. Could you tell me what the date is today?
No. Right off, I couldn't tell you, but I think it's about the 18th.
The 18th of what? What month is it?
Well, we are not July.
No.
It's July or August.
This is September the 11th.
September the 11th.
1990.
1990.
Okay. Now, how old are you now?
78. 77 or 78.
77, that's
Yeah,
right.
Yeah,
Very good. And what's the date today?
the 19th,
The 19th of what?
September.
No, it's September the 11th.
September the 11th.
And what year is it?
1984?
No, it's 1990.
1990.
Yeah. It was very clear that he could store practically nothing new. That is, I kept on telling him the date. He couldn't remember the date. I mean, I was unable in the course of that total interview to really teach him the date, that it was September 11th, 1990. He couldn't learn it. In fact, you'll note that in parts of that interview, he had forgotten that information within 10 seconds. That is, I would tell him the information, distract him by asking him maybe my name or something else for a few seconds, then go back and say, what's the date? And he'd go back to telling me it was 1984. That is, in 10 seconds, the information had been lost. That what we're seeing there is the inability to consolidate any new information or to transfer it from short-term memory into a kind of long-term memory. Do you remember John Kennedy at all?
Something of him, yes.
Yes. Was he a president of the United States, or what did he do?
Yes, he was, if I recall correctly, John Kennedy.
Was he ever president of the United States?
Well, Kennedy was, but I'm not too sure that the John was.
Mm-hmm. Well, John Kennedy was president of the United States.
He was.
Yeah. Huh? And do you remember what happened to him, or what happened during his presidency?
Well, if I recall correctly, somebody took a shot at him.
Yes, and what happened?
It seemed to me as though he was hospitalized for quite a little while, and I believe he fully recovered.
He did fully recover, huh?
Yeah.
Well, actually, he died. He was assassinated.
He was actually assassinated.
Yes, he was. A man of his attainment in life, he certainly should have remembered that John Kennedy was assassinated. That is, there are many things that he forgot or could not recall at this time that he once knew. You'll also note that there is kind of a temporal gradient to that loss. As you go back in time, his memory gets better. That is, his memories for the 1940s is better than his memories for the 1960s and 70s. So as you go back in time, his memory tends to overall get better. That is typical of a Korsakoff patient, typical of any amnesic patient.
Hi, honey. How's your game?
Oh, it wasn't too bad.
The inability to remember most of the events in your life for the past 30 years is a significant handicap. What enables Wyatt Ingram to cope with his difficulties is a highly structured living environment where life remains as familiar as possible.
Anyone that lives with a person with the type amnesia that he has to be able to stay calm and live with it, because they are unable to do anything about it, really. And Wyatt is very good about improvising and being very independent, and where he needs a little help remembering, because he can't remember what he did 5 minutes ago or an hour or yesterday. He has a burden with me too, because I'm physically unable to do many things. So he does the physical part of it, and all I have to do is remind him to keep doing it, because if he leaves it, like he was washing windows yesterday and he forgot what he was doing. So I have to remind him to continue washing the windows, and he's been going to trim the hedge out here, and I remind him to do that. I don't know what I'd do without him, but he doesn't know what he'd do without me either. So.
The human brain is a complex organ, but it is not beyond understanding. Medical and technical advances yield more information about the inner workings of the brain every day. But it would be wrong to assume that someday scientists will find a neurological reason for every psychological problem. How we are shaped by our genes, by our environment, and by our interaction with other people is too complicated a process to be determined solely by damaged or defective brain cells. Nick Crane suffered a traumatic head injury. Larry Gorell has Alzheimer's disease. Wyatt Ingram has Korsakoff syndrome. Each of their lives has been fundamentally affected by the damage their brains have suffered. The understanding that medical science has provided about the origin of their problems is significant, but the knowledge of how those problems will affect their daily lives will continue to be provided by psychology, the science of human behavior.
It's difficult to believe that we're going to find a pill or anything else at some point along the way that's going to suddenly cause new neurons to sprout. That is almost inconceivable to me. Hence, in many cases of, perhaps most cases of organic brain damage, we have no realistic hope of achieving cure of the problem. On the other hand, there is this whole array of psychological problems that are visited upon the individual with significant brain damage, many of which, for example, combativeness, are not, again, the necessary product of brain damage, but rather of the psychological situation in which the individual finds himself or herself. Now that can be worked with psychologically. And as a matter of fact, there is a fair amount of data, increasingly so in recent years. It demonstrates that people who are getting on in age and beginning to have Alzheimer-type dementia problems can be very substantially helped psychosocially. Their life burdens can be much lessened by virtue of appropriate psychosocial measures, such as, for example, setting up the environment in such a way that the individual is still making his or her own choices